So what's going to happen here is basically we're going to talk about two projects, and we're going to divide the day by 2 half days. In the first part of the day, we're going to talk about the ReMO COST Action called Researcher Mental Health. And in the afternoon, we're going to talk about an associated project to this ReMO networks, this ReMO COST Action called OSCAR, where we basically developed an AI application together with an associated methodology to help doctoral students, researchers, when it comes to their mental health and career development. So these will be the 2 parts of the day, 2 different projects. And But before we get started, a few words about the logistics. So first, this is a hybrid event, so we Zoom everything outside in the internet. So we will also have a Zoom audience here. It's quite nice, but it's also challenging from an organizational point of view. We also have internet access here. It's written on some papers on the wall, and also you can find it outside. But in case you haven't found it yet, then you need to use the Tricoterie free network with the pass Fabrique de Lignes. Sorry, my French is not the best. Okay, so this is how you join the network. If you need help or you have questions about this event or about the projects, about anything, please don't hesitate to go to the registration desk and ask the ladies there. Oops, my presentation is gone, at least from my face. One important thing from an administrational point of view, please don't forget to sign the attendance sheet. This is very important for us because this event is sponsored by the European Commission and the COST Association, and we have to prove that you were here and you were attending this session. This is how we get our funding. So please don't forget it. Last but not least, please enjoy this event. Please enjoy the atmosphere. It's an opportunity to get to know each other, to network, to get a bit of an insight of all the technology and methodology, what we developed here. And last but not least, join. So it's an open network. The COST action is very open for everyone who is motivated and want to contribute to all the activities and aims, and you know, also when it comes to the reusability of the technology, we are more than welcome you to come on board and test our methodology and technology. Good. So any questions about the logistics so far? If there are no questions, then we can go on and start talking about the problem. Why are we here today? So probably if you are part of the researcher community, you see that there is really a number of cases growing when what we can associate with mental health problems and psychological disorders. And it's really a huge issue, because some papers say that every 3rd person in our community is affected, which is huge. But how does it look like? What people actually experience at the workforce when it comes to researcher well-being and our well-being in general? So back in 2021, I did a workshop in Hungary with like 70, 80 PhD students. And I want to show you some quotes, what these people say about their work and about the academic environment. So the first one is, I feel guilty and anxious all the time because I feel like I'm not doing my work well enough. The second one, I constantly feel guilty when I'm not only doing research. I feel that after the PhD, I will have almost no knowledge of anything that is useful in the job market. Even my extended family or close circle of friends fail to recognize the value of research work. My working hours are not flexible. In the evening, I put the children to bed, then I have time for my intellectual task, but either I fall asleep or I can't manage them, but then after 2-3 hours of sleep, the clock is already ringing, because at 8 a.m., I have to be ready in my work uniform at the institute. It's very soul-crushing. As a woman, I never feel ready to have children because of the constant inflow of new tasks, projects, and responsibilities. And I'm getting older and afraid of running out of time. This is super frustrating. There is no differentiation on the basis of results and performance, which is not a motivating environment. The best colleagues and role models leave the field and are often not replaced by the outstanding ones. So I think from these quotations, you can probably feel that, there are some systematic issues in our world which need fixing. And the awareness of these issues, we feel it's still something what we can work on. So on a personal level, institutional level, or national policy levels, the awareness is still not really there. And I'm quite sure that this is something what we have to talk about. Mental health needs to be addressed, and we have to act now to avoid making the situation even worse. So innovation happens bottom up. That's why we started the Researcher Mental Health Observatory. It's a cost action. That means it's financed, it's a network financed by the Cost Association. We started working on this cost action in 2020. We got the funding in 2019. And currently, we are researchers from 41 countries. We are more than 250 researchers. Just for your information, when we started the action back in 2020, we were only like 30, 35 people. The proposal was written only by 10 people altogether. So I think you can also see how quickly the numbers went up, how quickly people joined this initiative and want to do something about research on mental health. Also, we have researchers from all different career stages and quite a number of organizations which represent researchers, represents researcher communities, including, for instance, Eurodoc or the Marie Curie Alumni Association or the Max Planck PhD Net. So we are relatively well representing the early career researcher communities. So what are the key activities, what we do in this cost action? First, we are organizing ourselves according to working groups. And the working groups have 3 levels. The working group 1 is focusing on policies around research and the researcher well-being. So there, the aim is to connect these researcher representativeness and the organizations, institutions, which deal with representation of researchers, focusing on systemic issues on a policy level, and really encourage the system level actors to include well-being and mental health related issues in their systematic approaches to improve mental health and improve mental well-being of researchers. We also have an institutional level working group where we focus on institutions and try to address mental well-being and mental health on an institutional level. Here we want to, and we are collecting evidence, what works and what doesn't work. We deposit this evidence into an evidence hub. This evidence hub is openly available for everyone. So if you go to the ReMO website, you will have access to these resources. And we also want to encourage institutions to share their best practices, share and discuss their best practices, because I'm quite sure these institutions can learn a lot from each other. And last but not least, we are also focusing on a local level. personal level, on researcher level. What can we do to help each and every individual in our community to help to develop sustainable and enjoyable research climate? But there again, we have to understand what are the determinants of the sustainable career perspective, sustainable well-being perspectives, and we have to focus on individual level interventions as well, like peer-to-peer supports or creating small networks. And after Corona, we realized that, oh, we also have to look at how we can sustain this in the online space. So how can we create online communities who can support each other? So all in all, this is what ReMO does. Again, you are more than welcome to join this cost action and join this initiative.